30-hour giving campaign, and we are joined this evening by Becky Robinson. And Becky, you're with an organization called CHESI. However, I know there's a much longer name to it, but let us know a little bit about what your organization does.
Yes, well, thank you so much for this opportunity to share more about CHESI. And CHESI stands for Community Health and Emergency Services Incorporated. And we've actually been incorporated since 1981. So we are in our 42nd year of serving Southern Illinois. We're a network of 9 federally qualified health centers, and we serve the 7 southernmost counties of Illinois. So we have health centers in Carbondale, our Cedar Court Clinic. We also have health centers in Cairo, our Cairo Mega Clinic, as well as a Cairo Diagnostic Center there. We also have a health center in Harrisburg and Carmi, as well as in Elizabethtown and Golconda and Hardin County and Pulaski and Tams. So our organization has been serving the most distressed counties in the state of Illinois for over 40 years.
Now, I definitely wasn't aware that you had such a large footprint, but I am aware of the services that you offer, because I know that they are, when you look at these counties that you just discussed, these services are much needed. And so tell us a little bit about what you offer and what the money that's going to be donated during the GiveSI campaign will go to.
Yes, we offer comprehensive primary medical care. We have fantastic physicians as well as nurse practitioners and family practice doctors and a whole range of behavioral health clinicians and others to serve our needs. But we have primary health care offered, comprehensive family planning services. We also have dental care in many of our communities, and we have behavioral health services as well. So if you're looking at if you need a medical care, regardless of any barrier that you face at this moment, our goal this year is to start a CHESI Cares program with the funding that we can raise this year. And that's going to help us better serve our patients that might need access for transportation to get to the doctor. We also have goals of establishing healthy food markets in our health centers so that when patients and families come to see the doctor, come to get their screening, they can go home with some healthy food as well. So our goal is to really address those social determinants of health, which do tend to impact health outcomes. And that's where a lot of this funding will be to support that this year in a transportation program to better serve our patients.
So that's amazing. I know we talk a lot about, some of these wraparound services and being able to treat the whole person in different aspects. And so not only is that important, but I want to make sure that we make the distinction for you in that the money received during the GiveSI campaign is going to go specifically for patients who need help with access, whether that's access to transportation, access to healthy food, access to what they need in order to maintain that health and wellness.
That is right. We are going to dedicate the funding that we receive through GiveSI for our CHESI Cares program. And that will help our practitioners and our staff identify patients in need and be able to directly serve those patients. We also are growing a patient-centered medical home model. So that's a chance for patients all over Southern Illinois. Maybe today they don't feel like they have a doctor. Maybe they haven't really seen a doctor or gotten care in a long time. You can call CHESI, and we will schedule you with your own doctor's appointment and screening. And we'll be able to make sure that you have the resources you need to arrive at that appointment and also to be able to have a better health outcome.
Becky, when you're talking about that kind of home care, what is the deterrent of people not wanting to do that? Like, how do you reach out to them? How are you getting them to actually say, hey, we're here to help you find a doctor and all that? What is deterring people from actually making those calls and connecting with you?
Well, what we find actually is transportation has been a big barrier, and people don't necessarily set themselves up for failure. So if they feel like they don't have a way to actually get to the doctor, it might actually prevent them from even reaching out for help. And that is something that we found with actual data this year. We've looked into this. So even with the outreach that we've done recently with being able to call patients ahead of time, make sure that they are able to arrive at the clinic or set up those support systems that they need, we found with just that extra bit of attention is helping. So we know with these additional resources, patients are going to feel more confident that they can actually accomplish these goals of of having health care for their whole family and having it close to home and delivered in a high quality manner.
It's amazing to me to think of people not being in an area where family can take them or transport them. Or on the flip side of that, sometimes the older population doesn't want to feel like they're a burden and they don't want to call kids and grandkids. But at the end of the day, trying to get them to feel like you need to put your health first, it's really hard to do that.
Yes, it is. And it's so important. And, you know, living in Southern Illinois, sometimes we really kind of just get used to the thought that we live in an area that's considered a shortage area for health professionals. Well, think of a community like Cairo, you know, Pulaski, Mounds. You know, there's studies that have been done in the state of Illinois, and these counties are considered the most distressed counties in our entire state. So when you think about being in a distressed place, you don't have access to all the things that we might take for granted in a larger community, right? But at the same time, that's why we're there. And we're so proud to be a part of the Cairo community, to be in Carmi, to be in Harrisburg, to be in Carbondale. And our goals this year is to really raise the awareness that these services are there for you, regardless of your ability to pay. We offer a sliding fee scale for every patient we serve. You do not have to have insurance coverage to be served, but if you come to our CHESI care centers, we will work with you to make sure that you can access health insurance coverage as well. So we're there to serve in a comprehensive way, whatever the needs of our patients and their families may be.
And, you know, as we talk about how important access to care is and all of those things that go with it, right? Your donation today means that someone's going to make it to that doctor's appointment well before it gets to the point that they're having to, you know, to visit an ER, or they're having to, you know, there's a more comprehensive or chronic problem. So, you know, when we talk about GiveSI and we talk about the nonprofits who participate in it and what they're doing in the community, I mean, this is really a matter of being able to help someone have access to get to see a doctor when they need to.
Yes.
If their child is sick.
Yes.
If their child, you know, has a medical emergency, if there's been an accident, if there's any of those situations where they need access somewhere. Now, obviously, an accident emergency would be quite different. But if it's a situation where a mom needs to get their child to the doctor, right? This donation means that you're going to be able to provide some of those resources to allow them to get in to see the doctor.
Yes. And we are screening all of our patients for what's considered social determinants of health, so that we can identify what some of these needs may be before they even arrive to the clinic. And there may be other needs too that are impacting their health. Housing instability, for example, employment assistance. We have a team of community health workers that engage with every patient. So we really want to be a part of that solution.
Well, that's fantastic. I know that you have, like I said, a footprint in the community. You're doing some wonderful things as a medical facility, but now to see how patients are going to have access to some of that they're going to be able to get to those appointments. They're going to be able to find healthy food options.
Yes.
And it's going to be meeting them where they are is tremendous. So if you're thinking about donating today, CHESI would be a great organization for you to really look at how much of an impact your donation is going to make. I think, you know, when you put it in terms of real life and real world, where you need to think about getting access to see your physician at the time that you need it, that's so critical and so vital.
Yes.
So the services are definitely needed. Is there anything else, Becky, that you want to tell us about, that you want to make sure that, you know, the donors know when they're thinking about using that donation for the CARES program?
Absolutely. What we're trying to do is reinvest back in each of these communities. And we are a recipient of a federal grant to help care for that, or cover the cost of that care for those that can't pay for their own care. But that only covers about 40% of our operating cost. We have about a $10 million budget to do this service across these 7 counties. So every dollar that's donated is just going to really help someone, you may know yourself, receive high quality medical care, regardless of their ability to pay for that service. And we never want anything to be a barrier between a patient being able to take themselves or their child to get the care that they need. So we've actually invested, and we've actually bringing in some new providers. And I'm excited to announce we have a new dentist in Carbondale. The Cedar Court Clinic has new dental services, and we're going to be taking this to a new level, we hope, this year. And that's all due to the support of wonderful campaigns like GiveSI and the support we have across Southern Illinois.
That's great.
Yeah,
I can tell you're very excited about it, to be able to bring that service.
We're thrilled about it. And the dentist that we've brought is outstanding. And he hasn't lived in Southern Illinois before. He's just blown away by the way our community supports each other and the type of atmosphere that we have there, where we really do care.
Well, it sounds like he's going to be a part of a great culture,
yes,
and a great organization to do that. So let's remind everybody real quick the locations, because if you live in one of these locations,
yes,
you definitely want to invest in CHESI. And you are going to want to donate, so that way we can help get people to the locations they need to. So let's roll off those communities one more time.
Fantastic. In Cairo, we have our Cairo Mega Clinic. It is a fantastic facility. We also have a diagnostic center. We're actually one of the very few federally qualified health centers in the United States that has its own diagnostic center. And we also have dental care in Cairo. We also have a brand new 3D mammography screening unit that we purchased this year. Now I have a success story to say that we have found a woman with breast cancer using this tool already, and she didn't even have symptoms. So it's so important that people realize these resources are there for you in your local community. So Cairo is actually where our organization started in 1981. And we're really proud to serve Cairo. And we have a medical center in Pulaski, in Tams, in Golconda. We serve Pope County with our Golconda clinic. We have a great Harrisburg Medical Center and a dental clinic there. Fantastic providers. And our Cedar Court Clinic here in Carbondale, it's located off of Striegel Road, back where all the medical clinics are there at the very end. But we have capacity. We can take in new clients, new patients. And I'm really excited if people will take advantage of this opportunity. They can actually call 1-877-MY-CHESI, and you can receive an appointment at any of these clinics. Carmi, Carbondale.
CHESI.
MYCHESI. Call 1-877-MY-CHESI, and we'll set you up with an appointment at any of our clinics across these 7 counties.
Excellent.
That's fantastic. We're really super excited about having you here. This is the first time participating in GiveSI. So we hope a lot of the training and tips and techniques that we've been able to share will be helpful to you. I can tell you right now that the second that you mentioned a new dentist in Carbondale, this video is probably going to go viral. Probably more than some of the other ones, because you and I were talking about how important it is to have those dental services, especially at a Medicaid level.
Yes.
And so now the donations that you give tonight will help get that person to get access to a dentist.
Yes.
In Southern Illinois. That's incredible. So we just want to thank you so much for the work that you're doing and being able to just take some time to share that with us, to share the story with us, and to kind of let us know about what you have going on and how that CARES program is really going to impact Southern Illinois.
Thank you so much. And we're proud to serve Southern Illinois, and we hope to be here another 40 years.
Good luck.
Thank you. Becky.